Interpreter is Damien Evans. Let's begin. A disease that has no treatment or cure has caused havoc in many countries, not sparing even the most developed of economies. For the last 100 days since its first case, Kenya has tried to step up its efforts to aggressively contain the virus. But the numbers seen so far might be an indication of a country living at the mercy of the virus. Our medical correspondent, Dr. Mercy Korir, tracks back Kenya's 100 days under Covid-19 in this report.
Kenya so far might count itself lucky that the coronavirus has been like a slap on the wrist for a majority of the people. Earlier projections and models had predicted that 10,000 Kenyans will have the virus by April, with a peak expected in August-September. 90% of all cases have had no symptoms whatsoever, and the other 10% present either with a cough, fever, or difficulty in breathing. Other symptoms are headache, running nose, sore throat, chest pain, general body weakness, sneezing, and joint pains. 2.7% of people who have contracted the virus, however, have died. Though the government has no comprehensive data on these deaths, the Ministry of Health has tried to explain the underlying issues leading to these deaths.
Diabetes is very heavy on the list of the causes of the disease. Among those with underlying cases, there are also very many cases of cancer. There are also cases of high blood pressure. But we also have people who are not sick before and who had no underlying issues.
The unanswered question here is, could the deaths have been avoided? Are these deaths an indication of the kind of healthcare services in our facilities, be it private or public hospitals, or are people dying at home? People above 60 years of age have paid the ultimate price with their lives. Half of all deaths have been people from this age group, more men dying than women. So far, only one child and a teenager has died from the virus. Even as the numbers soar, Kenyans are gradually going back to their lives as they knew it. Life is slowly crawling back to a new normal. Is it that people are no longer living in fear of the virus?
The lived experience is what informs most people. If nobody you know, no one around you has ever been infected, as far as you're concerned, even if you're told it keeps increasing, what you see every day doesn't tell you that, so you will not believe it.
Soon after schools were closed from the week beginning 16th March, mandatory quarantine for all international travelers began on 25th March. Testing of everyone who was in mandatory quarantine began on 29th March, but it was not until the 6th of April that a 5 a.m. to 7 p.m. curfew started, an exercise tainted by overt police brutality. On the first day of May, the government embarked on mass testing, an exercise that has yielded many confirmed cases of Covid-19. And with that, Kenya's graph is on the upward trajectory. Out of the more than 133,000 tests done, only 3.3% have turned out positive. So far, almost all cases are locally transmitted. That is, 9 in every 10 confirmed cases. And the major carriers are men. 2 out of every 3 cases are men between 30 to 39 years of age. Overall, people in the age bracket of 20 to 49 are likely to be infected. The fear being that these will be the super spreaders, considering that they are likely to not have any symptoms. All is not lost though. While hydroxychloroquine has been dropped for showing not much promise in the management of COVID-19, dexamethasone and a readily available steroid may be the drug that minimizes the harm from COVID-19. Out of more than 100 vaccine candidates, 11 are undergoing clinical trials, and this may give some hope for a long-lasting solution if successful. One of the COVID-19 mysteries that is yet to be answered conclusively is why some people sail through the illness unscathed, while some suffer severe lung damage and others die. Data and information gathered over the last 100 days lay bare the hits and misses that the country has had in its efforts to contain the coronavirus. The big question perhaps is whether these lessons will inform the next steps and what those next steps will be, because from all indications, the coronavirus is here to stay. Dr. Masi Korir, KTN News in Nairobi.